Hello dental implant family, Alina Naraki here, and we are going to be talking today about treatment of the dental infection. When it comes to treating infections in the mouth, dentists have several effective methods at their disposal. The type of treatment recommended will depend on the severity and cause of the infection, as well as the overall health of the patient. Here are some common ways dentists treat infections in the mouth. Number one, antibiotics. If the infection is caused by the bacteria, the dentist may prescribe antibiotics to kill the harmful bacteria. It is important to take the full course of antibiotics as directed, even if the symptoms improve. Number two, drainage. If the infection has formed an abscess, the dentist may need to drain the pus to help the area heal. This is typically done using a local anesthetic to minimize discomfort. Number three, root canal. If the infection has spread to the inner pulp of the tooth, a root canal may be necessary to remove the infected tissue and prevent the spread of infection. Number four, extraction. In severe cases, the infected tooth may need to be extracted to prevent the infection from spreading to surrounding teeth and gums. Number five, scaling and root planing. If the infection is related to gum disease, the dentist may recommend scaling and planing, which involves deep cleaning of the teeth and gums to remove plaque and tartar buildup. Number six, oral hygiene education. The dentist may provide education on proper oral hygiene practices such as brushing and flossing to prevent further infections from occurring. Overall, the best way to treat infections in the mouth is to seek prompt dental care. With the right treatment, most infections can be effectively treated and prevented from causing further complications. Once we get treated, we can definitely think about restoration of the teeth to bring everything to its previous vitality and beauty. We can achieve this by a number of ways. For example, if the patient shows up with an infection like this, and we have to extract all of his teeth or hers, then we can surrender to the treatment plan with the dentures, if that is an option for the patient. There is different type of dentures, which we are not going to discover in this video. Another option that we can actually do is we can extract the teeth and then place the implants and replace the missing tooth with the help of an implant. That can be done in the front, that can be done in the back, or any other place in the mouth. Another option we can deploy is we can do fixed bridges. When the teeth are missing or we have to extract them again, we can do multiple crowns, splint it together, presenting a bridge, and that is also a very viable treatment plan. Also, we can just remove the infection in the mouth by treating the infected teeth due to the cavities. And that is a result from removing cavities from the teeth and going to healthy teeth in this patient. And that will cover our conversations for today. Thank you very much. It was Alina Naraki from Dental Arts San Diego. See you in the next video.